Hello. Just waiting for some folks to hop on. Not a ton of time today since we're trying to get some guidance together for businesses. So, I'm going to keep it to 15 minutes. I know I kind of always say that and always go over answering questions, but I'm really going to try to keep it to 15 minutes today. Sorry, I'm pulling numbers up on my other phone here. Okay. So we're up over 100 now, so we'll go ahead and get started. Just kind of a basic update. Numbers are still the same as yesterday, so 29. And I don't think we'll be having any updates to the breakdown of actual cases today, other than we'll update the testing numbers that we update every day again. Those are not required by law to be reported. So, those are the estimates of what we get in, what we actually know have been reported to us as negatives or pendings, including the positives inside that number when we report out testing numbers every day. So right now I know that's 464 people that we know that live in St. Francis County that have been tested for COVID-19. But again, that's not mandated to be reported to the health center. So there's likely more, but it's hard to know how many more because only positives are mandated by law to be reported to the health center. And that's the 29 cases that you see. I want to talk a lot about reopening today and try to answer some questions in the comments, but I want to talk about what Monday, May the 4th, is going to look like. But first I had a question from the website about how deaths are reported. And I know this was on a post a few days ago, but deaths are reported by doctors, hospitals, and coroners, and they come in the form of a death certificate. So the state criteria is that if a death is listed on a death certificate, if COVID-19 is a cause of death on that death certificate, or a significant condition contributing to death, it is coded as a COVID-19 death per state guidelines. So that is the direction that we've been given for state, and that's how those are broke down. So whether it's a cause of death or a significant condition contributing to death, it is counted as a COVID death. Okay, I want to talk a little bit about reopening. So you probably already know that on Monday, the governor announced reopening of most or all businesses in Missouri on Monday, May the 4th. That's going to look a little bit different community to community, most likely, especially in your more metro areas like St. Louis and Kansas City that have a different level of transmission happening there. So I know that St. Louis has extended their order, and for specifics on their order, you need to visit their site. But the intention of the governor is that most places in Missouri are going to be able to open up their business in some type of fashion in their local areas. So that's what we've really been working on, in addition to some other requests in the last few days, is getting some guidance together from the CDC, from the FDA, some guidance for restaurants, salons, and churches, all of those nitty-gritty type of questions that we're getting asked to try to help guide them along. Again, these are guidance. They're not mandates, but they are recommendations for best practices. So we'll be having those updated tomorrow on our website. That'll be all up on the website, and then we're sending those out to the businesses over the next today and tomorrow, getting that information out so that they have it to continue their business operations. So I expect, as we've talked before, that it's not going to look the exact same as it did before we were in a COVID-19 response. So it's going to look a little bit different, but hopefully we continue on the path that we're on and that we're not seeing, active community transmission that we're concerned about. We looked at ER data yesterday, and we're looking at that every week. And it looked like there was kind of an uptick last week, and then in the last couple days it's dropped down again. So that's always good news as well. The ER data just shows people presenting with COVID-like symptoms. So that's important to know as well. But we'll be keeping an eye on that. We've got some other things that we're working on for what we call active surveillance. So that's usually in broad terms that we are looking for cases before they are positive cases. So when we do investigations on positive cases, that's called passive surveillance. So that means that we're doing investigations after that case has been confirmed. But some of the things you see where, they're checking temps and where they're asking employees, questions about, have you been sick? Have you had a cough? Those types of things are all pieces of active surveillance. So they're trying to figure out who's sick before we know exactly who is sick by a lab. So those are things that are going to be really important going forward. And the CDC has lots of recommendations out there. I know their website is very vast, but they have lots of recommendations out there for businesses and different types of businesses. So I want you to go check those out, and if you have questions, refer to those at this time, but we're going to have guidance up by tomorrow for several different sectors. But I did want to discuss a little bit the release that County Commission is putting out. Either today they already have, or they will soon. We work with County Commission. We're actually a political subdivision, so we're not under the commission, but we work with them on efforts in the county. So I'm just going to kind of read and read some kind of highlights from the information that they're putting out today, because in addition to the statewide plan, there are national guidelines that the president has put out for recovery, and some of those guidelines are a little bit different from the states, a little bit more strict actually. So we want to continue to support those guidelines. So the County Commission is putting out a statement, and we'll put this up on our website as well, but it talks a lot about phase 1 in coordination with the president's guidelines, and that restaurants and places of worship can remain open with social distancing rules in effect. And these are kind of general, so not too nitty gritty, but like I said, we're working on that. Elective surgeries can resume. Schools are to remain closed, of course, as you know, and then there's some information on the state's website about summer school. High-risk individuals, so people who are high-risk or vulnerable, really should continue to shelter in place, and that is a part of the statewide guidance and the national guidelines as well. Barbershops, beauty salons, nail salons are going to be able to reopen, and we'll have some guidelines for them. No one should visit senior living facilities. That was kept in place from the statewide order. Bars, large venues, and gyms are going to be able to reopen, but with strict physical distancing and sanitation guidelines. There's some more kind of, I know this is mirrored, but nitty-gritty kind of information that the County Commission is releasing, and we'll put that on our website after I get off the live. But it really is just to encourage people to continue social distancing, and then to avoid, this is included in the national guidelines, to continue avoiding social gatherings that are more than 10. Again, these are recommendations, they are not mandates, but these are best practices so that we can continue on this path of minimizing community transmission and heading back to some level of normal. So I'll put that full statement out on our website here in a minute. Again, this is County Commission's, but we'll put that up on our website. So I want to kind of try to get back through some comments here, because I do have to hop off I have to use my time pretty wisely today. Like I said, we're working on guidance, and I want to get that to the businesses as soon as possible. Trying to scroll back through. Hi, I see some, just hey, how's it going? Yeah. Why has there been such a small amount of people that have been tested in the county? So we've talked a lot about testing. Less than 1%. That's about actually the percent that you see also across the state. So testing is a concern. It's been a concern, and it's hopefully going to be getting better. The state has released more allowing guidelines and some clarifications on their guidelines for state public health lab, because there are some qualifications for state public health lab, and then doctors can test who they see fit. So a doctor has to do an examination of a person, assess them, and the clinician decides who to test. So that's, again, kind of up to them. But we did send out a survey earlier to our doctors and our doctor offices to kind of find out what is your capacity for testing, and for us to help gauge what the barriers are to assist in that. But again, the health center does not test. Our main role here is to do disease investigation and surveillance. And so when you hear about contact tracing and epidemiologic investigations, that's what we're doing. And that's really important to isolate cases, quarantine the folks that are contact to those cases to prevent transmission. So trying to scroll through here. Wedding venues. Yeah, so it doesn't exactly address wedding venues super specifically in the statewide plan, but what I would recommend is that, you know, we do recommend the limitations of 10 still in accordance with the national guidelines. And national guidelines are 2 weeks at a time, so they use one incubation period. But if you're continuing on with weddings, I'm giving recommendations, not mandates. If you're continuing on with weddings, social distancing needs to be a top priority. And I think if we're speaking realistically, that's hard to do. But, you know, keeping family units separate. So, you know, I have a family of 4. So if my family of 4 attends a wedding, that my family of 4 stays 6 foot away from all other families during that wedding event, reception, whatever. So that's kind of the basis there for wedding venues. But specific questions, you know, please reach out to us. And then you can also read on CDC about gathering and events and things you need to think about. But social distancing is the big one. And it takes a little strategy in places like wedding venues. And I've already talked to a couple people today about, you know, baseball and that sort of thing. And so it's really strategic and, you know, using sanitation as well. Okay, trying to scroll through. I don't have much time. If cases start going up dramatically, will the stay-at-home order be reinstated? I think that's the big concern of a lot of people right now, because nobody wants to go back there and continue doing that. But we also don't want to see our hospital system get overwhelmed. And so right now the capacity of the hospital system is good and we don't have this surge of cases, but it's something that we're going to have to continue to keep an eye on, which is why you hear this huge importance being put on contact tracing. Because if we can contact trace, so that means, you know, if I was a case, you know, somebody would, you know, call, well, I haven't seen anybody, but if I had been in contact with somebody, you know, they would call that person because I said, well, you know, I went to my sister's house, and they'd call my sister and say, okay, you need to quarantine for 14 days. And so then those people who would have normally been out spreading that disease unknowingly know that they were a contact to a confirmed case, and they're told to stay home. And we were thankful because we've had really good cooperation out of our cases and their contacts. And I think that's why you see us, we've been just slow and steadily getting more cases, not this huge jump at one time. Because I think the most cases we've had reported in a day was 4, and that was like April 1st or somewhere around that. And so I don't want to jinx us. I'm knocking on my desk here, but you know, I hope we continue on that path because nobody wants to go back. You know, we're still there, but nobody wants to continue a stay-at-home order. Okay, I got 2 minutes. Gonna try to scroll through here. Will seniors graduation be able to be done? I've talked to a couple superintendents and we've had some conversations. What I heard on the governor's press conference last Friday when he was talking about the reopening guidance, it was said that DESE was going to be giving recommendations to the schools. To my knowledge, that hasn't happened yet. But, you know, yesterday I was discussing with those superintendents what that might look like and how to do social distancing. And so, you know, it's an important thing. Graduation is a huge moment in a person's life. And so we want to try to make that happen on some level, but some of those might be delayed into the summer, or they might just look different than what they have in the past. And, you know, we're happy to work with the schools on that to try to help them navigate that. And we have a good relationship with them. What are your recommendations for summer sports? This will probably be my last question because I've got to hop off here to continue working on guidance to get that out for the businesses. But I've talked to a couple city leaders this morning about, summer baseball. And my kid plays summer baseball too. So I would love to see summer baseball happen, but it needs to be done safely under the statewide guidance. And so some of that is going to involve, again, strategy. So that might mean that games are spaced out differently. So, one group can leave and the other group can get there without this huge group at one time. I encourage the use of every person having their own equipment so that there's not shared equipment. I know that's tough in rec leagues, but disinfection. Kids are not good at social distancing. I've got 2 of them myself, and they just tend to be a really good way to spread germs. So social distancing, if you're going to a summer ball game, when that starts happening, staying away from other families. And I know that's tough because, you're cheering on your kids, but, helping to stay away from those other families, 6 foot apart at least, the further the better, that will help. And then if you're sick, stay home. I think we all feel that pressure if our kid's on a team, and certainly that pressure I think increases as you get older. But if your kid's sick, if you're sick, if your family unit is sick, you need to stay home. That protects the people around you. That's going to protect the team, the people that are attending the game. And so it's really going to take some strategy on summer sports, and they're probably going to look a little bit different. But my understanding is through reading the statewide recovery plan that the intention is that summer sports are allowed to happen. But again, strategies on physical distancing and hygienic practices. So okay, I'm going to hop off here. I know there's comments coming in, and we'll try to get to those tomorrow or maybe early next week. I've decreased the lives down to once a week. So I'll be back on next Thursday at 2 p.m. But the next couple days, we've got to spend some time getting guidance out to those businesses so that we can head into May 4th and head into recovery. We appreciate you, and we know that it has not been an easy couple of months, and we've all had lots of transitions and lots of changes, and things are still changing. I get new information from the CDC every few days on different guidance sectors, and I understand that's frustrating for you all, but as data and science and research can catch up with the questions we're asking, those things are going to change. And so encourage you to continue following the recommendations of the CDC, the Missouri Department of Health and Senior Services, and continue that social distancing and hygienic practices. And we appreciate you. I will see you again next Thursday at 2 p.m. Thanks. Bye.